Good afternoon, I'm Alan Unell, and these videos are Healthcare Advocacy, where we address problems in the healthcare system and take actions to make a better system for all of us. Today we're going to talk mostly about private equity investment in healthcare. We're also going to revisit a topic we had yesterday, which had to do with health insurance companies' ghost networks and an extra action we can take to help make that better. But first, if you're watching it and it's January 16th, 2024, if you need an Affordable Care Act health insurance policy, this is the last day. Go sign up. If you go look in the description box below, you'll find a link to the Healthcare Advocacy newsletter. There is a link in that newsletter that will take you to the government site so you can sign up and get insurance. The good news is lots of people are signing up. The bad news is that 8 to 10% of the population doesn't have insurance, and we have issues. Before we get to the main topic, I want to point something out. Where I live in the Pacific Northwest, we had a representative in Congress who was not too crazy about having universal health care, but her child was incredibly sick, and I'll be frank, I don't remember whether it was a liver disorder or a kidney disorder, but she made sure that legislation got passed, federal legislation got passed, that took care of her kid. Okay, big deep breath. Now, let me mention to you that people take actions when it's your ox that's being gored. When a congresswoman arrived in Congress last year, her name is Representative Anna Paulina Luna. She is a far, hard right Republican from Florida. She joined the rest of the Republicans in staunchly opposing proxy voting. I don't know if you guys remember that, but it was if you couldn't get to the Congress, you could send your vote in with somebody else. A practice that was adopted by the House Democrats to allow for remote legislating during the pandemic. What a good idea. Then in August of last year, she gave birth to her first baby, and her perspective is now completely different. Now Ms. Luna is pressing to allow new mothers in Congress to stay away from Washington after giving birth and designate a colleague to cast votes on the House floor in their behalf. You know, they could do it for people that are out sick or on all kinds of leave, but you know, she only thinks of herself. Anyway, it's when your ox is gored, you take action. Let me give you a quick update about long COVID before we get to the main topic. I know we addressed this the other day. We wrote about it and talked about it a couple days ago. It turns out that the Senate Health, Education, Labor, and Pensions Committee, HELP, is going to be holding hearings on the effects of long COVID tomorrow, Thursday, January 17th. Oh, maybe it's either the 17th or the 17th. I think it's tomorrow, Thursday, although in my text I have 18th because I make mistakes. It's going to be 10 o'clock Eastern time. If you go down into the newsletter, you'll find a link. You can actually watch the hearings live, which I think maybe I'll do. 16th, no, it's Thursday the 18th. That's right. And I think I'm going to watch. It's just 7 in the morning. I'm in the Pacific Northwest. Let's talk about the financialization of healthcare. I have a friend who's also a subscriber to this newsletter, and she is a doctor, and she sent me a note about the financialization of healthcare. And so I want to make this available. The New England Journal of Medicine has just published a couple days ago a paper called The Financialization of Health in the United States. It has 3 authors, Joseph Day, Victor Roy, and Colleen Grogan. They all have doctorates, and at least one of them is a doctor. This team of researchers wanted to figure out what's the effect of financial sector ownership, this is massive investment, in healthcare facilities in the U.S. So it turns out, also down below in the newsletter, there is a link to a summary and some comments written in the Health Justice Monitor newsletter, and you can go and read those. But let me give you a reminder about how private equity works. In the past 10 years, private equity firms completed more than 8,000 transactions involving healthcare entities. There was an estimated combined value of about $1 trillion in those investments. They leverage capital from institutional investors like state pension plans, and these firms fully acquire hospitals and nursing homes and physician practices, dialysis clinics, hospice operations, a whole range of healthcare operations. And they do it really quickly because they've got so much cash. What they do then is a little bit nefarious. They strap these healthcare systems with large amounts of debt, and then they pay huge dividends to their investors and then quickly turn around and sell them. They're also involved in other activities where they do vertical integration. They separate, like a hospital, into a wide number of separate companies that all have to pay each other, and individual functions like labor and delivery or orthopedics or cardiac care are all made into separate companies, and they all have to show a profit. And if you don't show a profit, out you go, which is actually very common with things like labor and delivery, which, by the way, just for your personal information, often creates an issue where women have to drive really far, like 45 to 90 minutes in rural areas to get to labor and delivery, and that is in some ways responsible for the increase in maternal mortality and infant mortality in rural areas. So it's a really nefarious thing. The other thing that's going on with private equity investment in the medical world is doctors and hospitals are now selling care contracts. This is like, I don't know if you've ever had to buy an appliance on time, but you sign a contract and agree to make monthly payments at a certain interest rate. They're doing the same thing for medical care. They're also selling credit cards with high interest rates for medical purposes. And tons of people go to see the doctor. If you don't have the money up front, people put it on their own credit card, and they wind up running into problems. Bankruptcy is the end of the line for a lot of them. It's just horrible. Anyway, facilities have distorted their priorities in that they now focus on the services that generate the most profit. They often, as I mentioned, they often shed services that provide less income, like labor and delivery, mental health, primary care. And it's worth noting, nonprofit medical systems are not immune to this. They do it too. Financialization just changes the focus. So instead of aiming for good outcomes and healthy patients, the industry tends to now focus on how much cash can be generated as quickly as possible. The patient is just a means to a cash end. You're just generating the money for this machine. And truly, the patient suffers. There was a study I reported on about a week ago where some researchers got a hold of CMS, that's the Center for Medicare and Medicaid Services, data on nursing homes. And what they found is that when nursing homes were purchased by private equity investors, the death rate went up by 10%. Charming. Okay, so look, what if hospitals and medical networks didn't have to worry about paying for their salaries and infrastructure? If they knew that was covered, would that help? How about if there was a single insurance company that could negotiate all the prescription drugs for all of us at a fair price? Would that help the system? What if we had a system that trusted the doctor to know what's the best course for the patient instead of denying medical treatment to hold on to money longer? Would that help? Look, American taxpayers foot the bill for at least $1.8 trillion in federal and state healthcare expenditures in 2022. About 41% of the nearly $4.5 trillion in both public and private healthcare spending that the U.S. has recorded in a recent annual report by the CMS, the Center for Medicare and Medicaid Services. On top of that $1.8 trillion, third-party programs, which are often government-funded, and public health programs account for another $600 billion in spending. That means the US government is spending more on healthcare than the governments of Germany, United Kingdom, Italy, Spain, Austria, France, all combined. And they all have universal health care in one flavor or another, and they all cover their entire populations of 335 million people. That's comparable in size to the US of 331 million, but we don't cover everyone. There's that 8 to 10%, another 25 million or so, that don't get covered. And yet we're paying at least as much as they are. So for that kind of investment, we should be getting a system that focuses on patient outcomes, not a quick buck. Let's remind Congress to take better care of our money by enacting universal health care. So here's the action. It's really easy. If you have a cell phone, you can send an email to your member of Congress and your senators. All you have to do is go to your messaging app and send a message to 50409, and the message is sign, S-I-G-N, PJCKWX. Or if you want, down below I will include links, URLs where you can get a hold of your representative's email or phone numbers. But this is easier. So here's the email you'll send. I'm your constituent, and I just learned that our healthcare system is increasingly becoming financialized. Private equity firms executed 8,000 transactions in the last 10 years for a value of about $1 trillion. They focus on dollars over patients, as is evidenced by the significantly higher death rate in private equity nursing homes, about 10% more. They squeeze the life out of medical facilities, then distribute the profits, and then sell off the assets. In the process, important functions like labor and delivery, mental health services are shed, traumatizing communities. The US government spends upwards of $2.4 trillion each year for healthcare, and patients are not at the center. Put patients first and enact universal healthcare, like HR 3421. It will provide global budgets for medical facilities so their costs are covered. It will allow for negotiation of all prescription drugs for all of us. It will cover every one of us, cradle to grave. Look, you're my representative, and I know you care about your constituents, so show them you care and enact universal health care. Thank you. I want to switch gears and talk briefly about ghost networks. These are the health insurance company lists of in-network providers. Yesterday we talked about it. We talked about how insurance companies do not keep accurate track of their in-network providers. And these faulty lists help to lure us, consumers, in when we purchase a company's insurance policy, many times looking for that doctor or provider that should be on the list and is no longer available. Sometimes the phone number's wrong, sometimes they've left, sometimes they've closed, and the insurance companies are not keeping the lists up to date. This winds up being consumer fraud. Now look, sometimes state insurance commissioners, yesterday's action was to contact them, refuse to take action unless they have legislation to back it up. So let's call for that legislation at the state level today. Here's another ResistBot text message you can send really quickly on your cell phone, again, to 50409 in the messaging app. Type sign, S-I-G-N, P-R-O-F-J-Y. And of course, all of this will be in the description box. And you'll send a note to your state senators and representatives. And here's what it is, really quick. I'm your constituent. We all deserve a healthcare system that works for all of us. I've learned that the health insurance companies often maintain inaccurate listings of in-network providers. There are so many errors that these are called ghost networks. We are the consumers, and we are lured into purchasing their health insurance with the goal of having access to providers, and it is a disaster when they're not available. U.S. Senator Ron Wyden and the staff of the Senate Finance Committee have conducted a study recently that found systematically checking the directories of 12 insurance providers, systematically checking the directories of 12 insurance providers in 6 states, they were only able to make appointments 18% of the time because a third of the providers were unavailable due to inaccuracies or unresponsiveness. Look, this kind of thing is just out of bounds with universal health care, but we need help now. I want you, as my representatives, to build legislation that demands that health insurance companies maintain accurate lists of in-network providers and has penalties if they don't. We need accurate data to be good consumers, and that only comes with your help. Thank you. Okay, that's what I've got for you today. Down below, you can like, share, subscribe. You can also get a daily subscription to Healthcare Advocacy, the newsletter that we write, which is the text for these messages, and get it delivered to your inbox. If you have things you would like covered or topics you'd like seen, you can send me a note at healthcareadvocacy1@gmail.com or put it in the comment area. Okay, have a good evening.